Hi, this is Jeevaratnam and welcome to my channel Jeevan Astro Answers. What is asthma? Asthma is an inflammatory disease of the airways to the lungs. It makes breathing difficult and can make some physical activities challenging or even impossible. To identify asthma, it's necessary to understand a little about what happens when we breathe. Normally, with every breath we take, air goes through our nose or mouth, down into our throat, then into our airways. Finally, it reaches our lungs. The lungs are a pair of spongy, air-filled organs located on either side of the chest, that is thorax. The trachea is a windpipe, conducts inhaled air into the lungs through bronchi. The bronchioles, that is the smaller branches of bronchi, eventually ends in clusters called alveoli. In the alveoli, oxygen from the air is absorbed into the blood and carbon dioxide, a waste product of metabolism, travels from the blood to the alveoli. Asthma symptoms occur when the lining of the airway swells and the muscles around them tighten. Mucus then fills the airways, further reducing the amount of air that can pass through. These conditions can bring on an asthma attack, which is the coughing and tightness in the chest that's typical of asthma. The most common symptom of asthma is wheezing. Other asthma symptoms may include coughing, especially at night when laughing or during exercise, tightness in the chest, shortness of breath, difficulty talking, anxiousness or panic, fatigue, chest pain, rapid breathing, frequent infections, trouble sleeping, dizziness, blue lips or fingernails. If the symptoms worsen or don't improve with the use of an inhaler, the patient should seek immediate medical treatment. Asthma caused by a variety of factors. Genetics connections impacts asthma. If the family members having the breathing disorder, the risk of getting asthma is high. Other factors include history of other viral infections, poor immune systems, respiratory infections, exercise, environmental irritants, allergens, intense emotions, extreme weather conditions, pests. Some specific types of asthma are allergic asthma. Allergens like pollens, dust trigger this common type of asthma. Non-allergic asthma. Irritants like cigarette smoke, viral illnesses trigger this type of asthma. Occupational asthma is a type of asthma induced by triggers like industrial chemicals. Exercise-induced bronchoconstriction usually affect people within a few minutes of starting exercise and up to 10 to 15 minutes after physical activity. Aspirin-induced asthma. It's triggered by taking aspirin or another NSAID. Nocturnal asthma. In this type of asthma, symptoms worsen at night. Cough variant asthma. It's characterized by a persistent dry cough. According to medical astrology, it's not very difficult to find out why a person suffering from these diseases. Mercury is the chief significator of asthma disease. Due to the cold planet, Moon is also significator of asthma. If Moon and Mercury are weak, afflicted, or associated with malefic planets, it indicates the native will suffer an asthmatic problem. In the horoscope, ascendant or lord is native. Third house represents breathing malefic. Fourth house represents the lungs. Sixth house is the house of disease and 12th house is the house of hospital. So, if above said house or house lord are affected, the malefic planets certain Mars, Rahu, Ketu, Moon and Mercury, and then short the person will suffer from asthma. But some information is known about preventing asthma attacks. These strategies include avoiding triggers and allergens, taking preventive medications and or allergen immunotherapy that helps our body become less sensitive to any triggers that we encounter, and also eating a healthier diet, maintaining a moderate weight, quitting smoking, regular exercising, managing stress, or some of the steps that each day to help make ourselves healthier and reduce the risk for asthma attacks. I hope you might have enjoyed this video. Anyway, thank you and have a nice day.